Hi guys, this is John Adamson, the Rehab and Documentation Guru. Yesterday I posted a video and today I realized it had no sound. So my apologies to the 6 people that watched it with no sound, because obviously you didn't get anything from it except looking at my goofy face making movements without saying anything. So anyway, I wanted to talk about a principle related to an approach to care that'll help reduce errors. And for those of you that know a little bit about my background, for the last about 2.5 years, I had been working in compliance in a work-from-home job. Well, I'm no longer in that position, and I'm now starting home health and working for a very large hospital organization in Virginia. And one of the things they use is what's called the STAR concept, STAR, to help reduce errors in patient care. And so I wanted to just help you apply those principles, because one of the things I talk about in my documentation class is the fact that we as clinicians need to be assessing our patients every single time we go to see them. And because of high productivity standards, we almost need permission as clinicians to slow down and actually make sense of what's going on with the patient. And this ties in directly. I'll give you an example. I knew a clinician a few years ago who was in a high productivity setting, and they used a lot of modalities in this particular setting. And he had a patient with a known contraindication to e-stim, a pacemaker, and he knew he had initiated that plan of care without e-stim, but he got in this just kind of the mode of seeing patients one after another, and lo and behold, applied e-stim to this patient with a pacemaker. Fortunately, there was no evidence of problems. It was reported from a compliance standpoint, documented. But, it could have been a bad outcome. Now, the STAR concept helps you kind of avoid that kind of thing. And ST, the first 2 letters, mean stop and think. Now, what is recommended from a stop perspective is that you take a minimum of 2 seconds, just 2 seconds to just stop and give your mind a chance to catch up. What they found was, this was an interesting study, they looked at nuclear engineers, people that are in charge of keeping nuclear power stations running, and very important job. You want these people to be paying attention. And they found that if they just took 2 seconds pause before they did something, like, I don't know what nuclear engineers all do, but adjusting some setting to alleviate, let's say, excessive heat, I don't know. They found that 2-second pause reduced their error rate by a factor of 10 times. So that's a lot of reduction in error. So think about that when you go to get your patient, especially if you're in a high productivity setting. Think for a moment. Stop. Think what you're about to do with that patient. Think about their precautions. A patient says they're thirsty. Oh, I'll get you something to drink. Wait a minute. Oh, yeah, you have a swallow dysfunction. Probably should be making sure that we get the appropriate thickened liquids. So we really need to take that time. The other thing is, and this is related to it, is assessment. Assessment should be happening before, during, and after you treat your patient. And so before you lay your hands on them, you should be taking a moment to think, what's going on. I worked with a clinician who, at the time, I wasn't as astute as I am now about, proper approaches to care. And she would sometimes just look at her patient. And it was a lot of seating and positioning, and she'd stand on one side and she'd be looking at the patient. And then she'd go to another side, and then she'd be like, and she would do this routinely every single visit with her patients. And I think it was a good visual reminder that we as clinicians should be in some ways analyzing or assessing our patients every single visit, including you assistants. You want to be carefully looking at your patient, even though you don't have the capability of the analysis necessarily. You should be looking for things that are problematic that you need to report to your therapist, and you got to take time to do that. And one of the things that Medicare recognizes is that skilled treatment involves assessment and analysis. And so that's okay. You don't have to jump right into Therex or neuromuscular rehab or dysphagia retrainer or whatever you're doing. You got to take a moment to breathe and think. And we get so high productivity sometimes we forget to think. So once you've stopped and then you've thought about it, then you can move on to A, which is act, actually do something about it. And then R stands for reassess. So you stop, you think, you act according to what you've thought about, and then you reassess. And that's consistent with a lot of the stuff I already talk about in my documentation course, but I wanted to bring it up to you because I like acronyms, words where letters mean something, and STAR is a good way for you to approach every single patient every single day to reduce your error rates. And errors for therapists can sometimes be just as detrimental as a medication problem that nursing makes an error on. Maybe not quite that detrimental, but there are some things we do that are potentially dangerous to a patient that we need to stop and think. Then we can act, and then we can reassess things went. Anyway, I hope you found this video helpful. If you did, please like, and if you haven't, subscribe. And give me suggestions in the comments about what you would like to see me cover in future videos. Again, this is John Adamson, the Rehab and Documentation Guru, reminding you to get paid for what you do. Take care, and God bless.